As a health professional, how do you identify the specific health needs of your clients? What natural means can you use to increase the capacity to help them? Are there physical signs and markings in certain parts of the body that guide us in our investigation and understanding of our health situation? In over 4 decades of clinical practice in natural health, we have used the eyes as a means of health evaluation successfully and effectively. This means of health evaluation is called Iridology, the art and science of observing the structure and coloring in the irises of the eyes as they pertain to one's constitutional makeup. Historically, iridology goes back to our earliest recorded history. Hieroglyphs from ancient Egypt show physicians peering into the eyes of their patients. There are also biblical references, such as Matthew 6:22, suggesting the eyes as a kind of viewing screen that can show purity of heart. Our current technology allows us to record what we are seeing and play it back for the client immediately. Let's take a brief look at a case history. This client presented with medically diagnosed painful arthritis. He is overweight and on several pain medications. The pain in his leg and back make it difficult for him to walk. We take his iology photos, meaning both irises and scleras, put them up on the screen, and then tell him, "Dan, your irises are saying that genetically this is a strong body with some vulnerability to over-acidity and a weakness in your stomach, bowel, and some of the endocrine organs. We also see evidence of the back trauma you suffer. The genetic overacid sign in your irises, plus your lifelong cooked food diet, likely precipitated the expression of the arthritis. Let's talk about how you can get into better shape. To deal with this pain very directly, what if we start with the 30-day liquid diet? After 30 days of the liquid diet, Dan came back for a second visit. We took follow-up iology photos and compared them with the previous ones. The before and after sclera images clearly show that his body is in a cleansing mode. This is based on the reduced caliber of many of the sclera vessels, the complete elimination of others, and the overall clarity of his scleras in general. Dan confirmed that virtually all his arthritic pain is gone, so he was able to eliminate his pain medication. He is now able to walk and work without pain. Encouraged by the improvement he feels in his body and the improvement shown by the signs in his scleras, he feels that he is now on the right path to health. With the iris information, plus the data provided by his scleras, you now have an impressive picture of the patient's health. And please note, this is only a fraction of what these eyes can show. Having witnessed this process so simply and directly, your patient is much more likely to comply with your directions on how they can make the life-positive diet and lifestyle changes and take control of their health. Clearly, this is a win-win situation. Committing to life-positive health change is a very big and important step in anyone's life. When you are ready to learn iridology, we have it all waiting for you on DVD.